teeth bleaching, Dr. Vuong, there are many ways out there. There's the over-the-counter. People pay rather little money. They go to, Safeway, to a pharmacy, and they get their bleaching kit. There are bleaching kits dentists like you disperse and give out. And then there are those machines, the zoom wide and laser and whatever they are called. And within very short time, an hour or less, you have white teeth. Can you kind of tell us a little bit what purpose each one has and when one should be used, not used, and the quality of each one of them, on side effects perhaps, and all that stuff?
Sure. There's basically three types of bleaching materials that exist on today's market. The first one would be the over-the-counter bleaching material that you can buy at any pharmacy, any drugstore. Products that include like Crest whitening strips, some paint-on whitening gels, and then the second type would be to make custom bleaching trays at a dental office, and which is supplemented with a professional bleaching gel. And
what's the difference between a professional bleaching gel and a bleaching gel you get in the over the counter?
The difference is the strength of the gel. The professional one, of course, is stronger and is a little bit more effective. The over-the-counter one is a little bit more diluted, a little bit less effective.
So, the less effectiveness, does that mean you never get the teeth as white as you want to, or does it mean you need to wear it more often, like instead of 5 days or 20 days, you need to wear it 60 or 90 days, or, what's the deal there?
I would say it just simply doesn't work quite as well on most people. The fact that, like, for example, the Crest whitening strips, they're kind of like little stickers with gel that you put over your teeth, but they're not really isolated on the teeth. So once you put it on, your mouth starts salivating, and the saliva just simply washes it away. So you never get a good effect.
Okay.
Whereas a custom bleaching tray it's custom made to fit perfectly on your teeth. So the gel solution actually sits on your tooth without leaking out. And without the saliva seeping in.
Because that's a problem. Even never mind the strip you just explained. But there is trays out there with that bleaching material in it. But those trays on the over the counter, obviously, they cannot possibly be counter made. So there's more potential for that gluey stuff to come out and be all over your mouth, I guess, right?
That's right. So the gel leaks out, saliva leaks in. So it's never quite as effective as custom bleaching trays.
Got it.
And then the third one is the in-office bleaching, where you actually use the strongest bleaching solutions to put on the teeth, and it gives the quickest effect. That's
how quick?
1 hour quick.
1 hour quick. That's quick.
Yeah.
That's quick. How long do the ones which you disperse, the trays which you make, the custom trays, how long, what's the work involved there usually? Is it you wear them every night, a month, a week, a day, a month, a week, whatever? What's the deal there?
Yeah, well, it just depends on the patient. Usually I recommend the patient start wearing it for like an hour and see if their teeth are really sensitive. If it becomes too sensitive, then I would tell them to just discontinue it for a while and then come back and try to use it for another hour a different day. But if it's not sensitive, then you keep on going. You keep increasing the amount of time that you wear it. So you go from an hour to 2 hours to 4 hours, and even some patients even wear it overnight. And
I see.
Yeah.
I see. So you can do it while watching television, doing things at home in the evening, come home after night, and take it out by the time you go to sleep if that's what you want, and if for some reason you feel comfortable with it, even leave it in. All right. If a person gets a bleaching, and then he keeps, which most likely is happening, he keeps his lifestyle, be that smoking, drinking coffee, drinking red wine, can he bleach them again down the road?
Yeah. You can bleach as often as you like, pretty much, as long as you can tolerate the sensitivity. If the sensitivity is too much, obviously you need to discontinue and let the teeth rest for a while. But bleaching can be used quite often. After bleaching, I highly recommend to the patients to not drink any red wines, any juices that are dark, coffee, pop, all that stains the teeth and it kind of makes the bleaching not as effective.
When you say after, you mean right away after or forever after?
No, right away after.
Oh, okay.
Just give it like a week, and then you can, go back to your routine and your lifestyle. But you just got to keep in mind, of course, if you're drinking all those dark juices and wines, or you smoke, of course it's going to stain the teeth, and the bleaching effect is just not going to last as long as if you avoided all those things.
Right, and then I think everybody understands that, and again, that's why I said it's unlikely that a person would change that lifestyle. I mean, if doctors can get a guy to stop smoking, drink coffee and red wine, for all the other health matters, it might possibly have. Forget it about, yellow teeth. If for a couple $100 you can bleach them, right? So, but he should at least stay away from it for about a week. Just like in the old days, when you went to a dentist, it's kind of like for 3-4 hours, don't eat, Now I don't think that's so much anymore the truth, right? Wonderful. All right. Good. Thank you very much telling us about bleaching.
Thank you.